Cardiovascular disease remains the leading cause of death in the United States, despite declines in mortality rates over the last 35 years. In today's HealthCast, Local 10 medical specialist Christy Kruger has details on a new study that takes a look at the risk rates among specific areas of the country.
Yeah, and you're going to be interested to hear this one. Researchers from all around the country combed through regional databases, and what they found is that there were substantial differences in heart attack and stroke rates depending on where you live. But here's the great news. The lowest cardiovascular death rates were found in 5 specific regions, and one of them was right here in South Florida. And when it comes to the very best locations for life-saving devices, things called automatic external defibrillators, I'm sure you've seen them, AEDs up on the walls. Well, it turns out restaurants as well as ATMs rank at the top of the list. That's because those 2 places were the most common spots for people to have a heart attack.
They're trying to figure out, okay, we have all these devices, where the heck do we put them? You know, we see them in the airports. We see them, you know, in various places, in hospitals, in public buildings. But maybe we should place them more strategically. Why don't we place them where people are more likely to have a sudden cardiac arrest or sudden death? And that was what this study brought to light.
So restaurants and ATMs. AEDs can check a person's heart rhythm and recognize right away any irregularity that requires a big shock. And the American Heart Association also reports that every year approximately 300,000 people over the age of 40 will experience an out-of-the-hospital cardiac event. And the more of these AEDs that are readily available, the better your chances of surviving a heart condition. And with your HealthCast today, I'm Christy Kruger.